Diabetes. A permanent condition or a disease that can be controlled. Have you ever wondered if diabetes really needs to be a permanent condition? Is the use of medication the only way to control this disease, or are there alternative paths to a better life? And how can lifestyle really impact the progression of diabetes? Although most conventional diabetes treatments focus on tight glucose control through medication, this often only temporarily controls symptoms. But can dietary changes, such as the Mediterranean diet or muscle strengthening, make a difference? It is intriguing to see how an approach focused on natural nutrition, physical activity, and consumption of prebiotic foods can complement and even transform diabetes management. Modern science shows that certain foods and exercise play a powerful role in glycemic control and overall health, raising the question, how can you incorporate these practices to improve your quality of life? Stay until the end and discover the keys to a new perspective on diabetes management. Let's get started. Traditional treatment and medication use. Diabetes, in theory, is a disease that is strongly linked to lifestyle, which means that adjustments to daily habits can bring great improvements in the condition. Unfortunately, often the most immediate solution found is the use of medication. In some cases, there are recommendations for dietary changes and encouragement of physical activity, but the focus ends up falling predominantly on the use of medication to prevent long-term diabetes complications. These complications arise because diabetes is a vascular condition that affects the blood vessels, and therefore treatment is aimed at preventing more serious problems, such as heart disease, strokes, and blockages in large arteries. In addition, special care is required for vulnerable organs, such as the kidneys and eyes, as well as measures to avoid neurological complications. Therefore, the main objective of treatment is not a definitive cure for diabetes, but rather to control the progression of the disease and minimize the risk of severe consequences, thus promoting a better quality of life and greater safety for the patient. Focused approach on diabetes maintenance. Thus, both healthcare providers and patients from the beginning choose to begin treatment considering the presence of diabetes as a permanent condition. In practice, this stance implies that it is acceptable to have diabetes indefinitely, rather than focusing on strategies to reverse or control the condition through healthier habits. In this context, the predominant approach focuses on constantly monitoring blood glucose levels or hemoglobin A1C values, rather than seeking lifestyle changes that can reduce dependence on such surveillance. Hemoglobin A1C is an important marker as it indicates the average blood glucose level over the last 3 months. It reflects the link between hemoglobin, a protein present in red blood cells, and molecules called advanced glycation end products, AGEs, which are related to the aging process and tissue damage. These AGEs can cause harmful effects on the body, contributing to the development of complications associated with diabetes. Monitoring the hemoglobin A1C value is essential, as it helps to evaluate the body's response to glucose variations after meals, revealing how the body deals with increases in blood glucose levels. However, without an emphasis on improvements in eating habits, physical activity, and self-care practices, this monitoring becomes just a palliative measure, leaving aside the transformative potential of a lifestyle change that could help control and possibly lead to diabetes remission. Glucose monitoring and the false sense of security. Although the initial diagnosis of diabetes depends on careful monitoring of glucose levels, this practice is rarely maintained in patients' daily lives. Thus, many limit themselves to observing data such as the average glucose levels after meals, the lowest fasting glucose value, or other indices that only suggest an apparent state of control. As a result, even without observing real improvements in their health, they find a false sense of security when continuing treatment, believing that they are in an acceptable condition. This phenomenon reflects a common problem among patients and healthcare providers, an incomplete or even misinterpretation of what control of diabetes means. In many cases, healthcare professionals prioritize the strict regulation of blood glucose levels, focusing on keeping them within a specific and often low range with the aim of avoiding complications. However, this strict control strategy, especially when carried out using medication, can generate a series of adverse effects. Studies show that excessive control of glucose levels, especially with the intensive use of medications, is associated with an increased risk of mortality from all causes. In other words, when trying to prevent diabetes from worsening, healthcare professionals can often inadvertently expose patients to greater risk. It is essential to rethink this approach so that the focus is on improving a sustainable lifestyle, which goes beyond numbers and promotes a true evolution in patients' health. Option to maintenance diabetes in a moderate way. Ultimately, many choose to manage their diabetes in a moderate way, since this condition, although controllable, has no definitive cure. Controlling blood sugar levels becomes the objective, keeping them at stable and safe levels. However, it is important to remember that when diabetes arises as a consequence of lifestyle-related illnesses, early modification of these habits can promote significant recovery. In other words, the sooner there is a change towards a healthy lifestyle, the greater the chances of reversing or stabilizing the condition. To control diabetes effectively, diet plays an essential role, and dietary guidelines have been widely studied and recommended. One of the most effective approaches is the Mediterranean diet, traditionally consumed in the regions surrounding the Mediterranean Sea. This eating plan prioritizes the consumption of fresh vegetables, nuts, whole grains, legumes, and fruits, with olive oil as the main source of healthy fat. Additionally, small amounts of red wine, rich in antioxidants, are also permitted and may offer additional benefits for cardiovascular health. This diet is known for its anti-inflammatory effect and for helping to regulate blood glucose levels, making it one of the most recommended for managing diabetes. The balance and variety present in the Mediterranean diet promote not only diabetes control, but also overall health, offering protection against cardiovascular disease and other chronic conditions associated with aging and lifestyle. Mediterranean diet and the benefits for diabetes. The adopted diet avoids the consumption of processed foods, fast food, and junk food as much as possible, opting primarily for whole and natural foods. The emphasis is on light and healthy preparation, avoiding methods such as frying or sautéing in hot oil and preferring options such as raw, steamed, or lightly cooked foods. This style of preparation, focused on preserving the nutrients in food, has been shown to be effective in contributing to health, with research indicating that this approach can help control diabetes. Studies involving more than 136,000 people show that a diet based on fresh, minimally processed foods, such as the Mediterranean diet, is associated with a significant reduction in the risk of developing diabetes. Observations of these populations reveal that people who follow the Mediterranean diet, rich in fruits, vegetables, whole grains, olive oil, and fish, have the lowest risk rate not only for diabetes, but also for a wide range of chronic conditions. Following this diet not only reduces your risk of diabetes, but also decreases your likelihood of developing cardiovascular disease, cancer, obesity, lung disease, and even cognitive impairments. This dietary approach is widely recognized by science as one of the most effective for promoting long-term health, thanks to its protective effect against various diseases and the encouragement of a healthier and more balanced lifestyle. Importance of prebiotics in controlling diabetes. When it comes to controlling diabetes through diet, in addition to the Mediterranean diet, there is another important approach: consuming foods rich in prebiotics. Prebiotics are compounds that feed the beneficial bacteria in the intestine, promoting a healthy and balanced environment. Some of the top prebiotic foods include psyllium, bananas, and certain types of oligosaccharides, which, when ingested, have been shown to help control blood sugar levels. These prebiotics provide the substrate necessary for intestinal bacteria to produce short-chain fatty acids. Short-chain fatty acids play a crucial role in maintaining gut health. They not only serve as a source of nutrition for intestinal cells, but also have anti-inflammatory properties that benefit the entire digestive system. The reduction in intestinal inflammation, provided by short-chain fatty acids, contributes to greater stability in blood glucose levels, facilitating the control of diabetes naturally. Studies suggest that people with diabetes tend to have lower amounts of short-chain fatty acids in their intestines, which is associated with less efficient glucose control. By regularly incorporating prebiotics into the diet, the body benefits not only from a healthier intestine, but also from a more stable and controlled glycemic response. This dietary approach offers an effective complement to diabetes management, showing that gut health and blood sugar control are deeply intertwined. Benefits of prebiotics in reducing glucose. Clinical studies demonstrate that the consumption of foods rich in fiber and prebiotics is directly associated with an improvement in glycemic control. Researchers concluded that diets rich in these components can effectively help stabilize blood sugar levels, making it an important strategy for people with diabetes. Foods such as vegetables, fruits, and whole grains, in addition to providing prebiotics, also offer fiber that slows down the absorption of glucose, helping to prevent glycemic spikes after meals. On the other hand, there is a less discussed factor but relevant to diabetes control: excessive consumption of proteins of animal origin. A common practice in managing diabetes is to adopt a low-carb diet. However, in some cases, this leads to the recommendation to eat large amounts of protein as a replacement. Unrestricted intake of meat and fish is often encouraged, but studies show that excess animal proteins can have adverse effects. High consumption of animal proteins is associated with reduced insulin sensitivity, in addition to increasing the risk of fat accumulation in the body. Instead of a diet based solely on carbohydrate restriction, it is crucial that the balance is maintained, with a focus on foods rich in fiber and prebiotics, which help with glycemic control. Limiting excess animal proteins can be a beneficial strategy for increasing insulin sensitivity, as well as supporting overall metabolic health. Therefore, a balanced diet, which values fiber and prebiotics and moderates the consumption of proteins of animal origin, seems to be a safer and more effective way to manage diabetes. Risk of excessive animal proteins in diabetes. Drastically cutting back on sugars and increasing your consumption of proteins of animal origin can bring more health risks than benefits. Studies indicate that, in a more balanced approach, where there is a good intake of legumes and vegetables, a low-carbohydrate diet can in fact contribute to the reduction of body fat and help control diabetes. However, there is evidence that a low-carb diet with high consumption of animal protein is associated with an increased risk of cardiovascular disease and even cancer. This scenario highlights the importance of a careful and balanced food composition. Consuming large amounts of animal protein without paying attention to other aspects of the diet can lead to long-term health impairment, even if blood glucose levels initially remain under control. The key is to avoid excess and prioritize a diet rich in vegetables and fiber, which help improve metabolism and control diabetes in a safer and more sustainable way. In addition to diet, physical exercise is an essential pillar for controlling diabetes. Regular physical activity increases insulin sensitivity, improves glucose metabolism, and contributes to cardiovascular health, helping to combat the harmful effects of an unbalanced diet. Therefore, the combination of a balanced diet with a focus on vegetables, fiber, and a moderate amount of protein, along with regular exercise, is the most effective approach to healthy management of diabetes and health in general. Exercises and muscle strengthening to control diabetes. Muscles play a fundamental role in regulating blood sugar levels, functioning as a buffer that helps absorb excess circulating glucose. Therefore, increasing muscle mass is highly beneficial in controlling diabetes. By building muscle, the body improves its ability to use glucose efficiently, reducing dependence on medications to control the disease. However, relying solely on medications or ignoring the body's warning signals can lead to a worsening of the condition. It is essential to understand that the body sends important signals when there are imbalances, such as an increase in glucose levels detected in tests. Ignoring these signs or maintaining a sedentary lifestyle and poor eating habits can seriously compromise the body's ability to recover. These changes are a call for lifestyle adjustments, including more physical activity and healthy food choices, which can minimize risks and prevent long-term complications. When health issues are addressed from the first symptoms, the body preserves its ability to regenerate and recover. On the other hand, continued neglect reduces this ability to adapt and makes controlling the condition more difficult, potentially accelerating the development of serious complications. Therefore, adopting a routine that promotes muscle strengthening and metabolic health is essential not only for controlling diabetes, but also for maintaining comprehensive and lasting health. Conclusion and final recommendations. Therefore, if you started visiting a hospital, if you were detected in medical examinations early, be sure to make improvements in your lifestyle habits. For those who find today's conversation useful, please click the high rating button. Please subscribe to the channel too.